set, go.
Hello,
Hi.
my name is Steven. I'm a PA student for Dr. A. How are you doing today?
Good.
Okay.
Pretty good.
All right. Well, I'm going to ask you a couple questions, see why you're in here today. Is that okay? I'm going to start off with the easy one. Is it okay if I call you Miss Lipscomb, or what do you want me to call you?
Katie's fine.
Katie? All right, Miss Katie. What brings you in today?
I'm having some lower back pain.
Low back.
And it's just, it seems to really be irritated by like walking around. And it initially, started, like a week ago, and it's just gotten worse. And then it started doing other things, and walking is really terrible right now.
So walking, it makes it kind of worse, okay?
Yeah.
And you said it started about a week ago. Was there something different you were doing about a week ago that made it worse, or?
Yeah, I was lifting, we're moving, and so I was lifting boxes and stuff, and
okay.
Yeah.
Can you point to me exactly where the pain is?
It's right here.
Okay. Now, is the pain staying there, or is it kind of radiating, moving out?
It actually radiates down my right leg.
It radiates on your right leg?
Yeah.
Okay. Have you ever had a previous episode like this before?
Never.
Never? No. Okay. No previous episode. Okay. Is there any other symptoms that you're feeling today besides your back pain?
Besides like the sharp pain, it's just really tight around that general lower back area.
Okay.
Yeah.
You said sharp and tight. Is there do you feel like any throbbing pain back there, or any like shock-like pain or anything like that?
When I bend over, yeah, if I'm like leaning forward at all, and then...
You bend over, what type of pain do you feel? Like the throb?
Sharp. It's like the sharp, and that's when I feel it down my leg a lot. And then when I'm walking, I feel it down my leg a lot.
Okay, so when you're walking, you do feel that it's going down your leg, okay?
Mm-hmm.
Is there anything that makes it better?
Kind of extending back tends to make it feel better.
Extending back, okay. Anything that makes it worse besides the walking?
No, not really. Just like I said, bending over as well, and then yeah.
So bending down, kind of walking, make it.
Any kind of movement, twisting.
Okay, movement or twisting. Okay,
yeah.
All right. Have you seen anybody else about this pain?
Mm-hmm.
Okay.
No.
All right. And you say you're not feeling any other symptoms today?
No, just that.
Okay. All right. Okay. Well, I'm going to summarize some things that you just told me right now, okay? So you hear some lower back pain. It's more irritated, and there's a sharp pain whenever you bend down, whenever you twist. It's like a tight pain back there. It does radiate down to your right leg.
Mm-hmm.
It started about a week ago. You're moving, lifting boxes. Let's see. It feels better whenever you extend back that way.
Mm-hmm.
I believe that's it. Did I miss anything with that?
No, that's it.
Okay, all right. Well, thank you for sharing. What I'm going to do now is I'm going to ask some questions about your past medical history, okay? All right, just try your best to be honest. Remember what you can, okay? Do you have any current allergies?
Not that I know of, no.
Okay, all right. What about any illnesses, any chronic diseases?
No.
No chronic diseases? What about any surgeries?
Yeah, I did have a back surgery.
Back surgery. Okay, how long ago was that?
That was like 3 years ago.
3 years ago. What happened?
I was playing soccer, and I just I wasn't eating really healthy, and I ended up getting like a hairline fracture in one of my
I'm sorry to hear about that.
vertebrae.
How's it doing now?
It's been fine since, yeah.
Okay, and you haven't seen anyone else about that? Like, you haven't gone back? Okay, but it's doing okay right now?
Yeah, it's been completely healed, and I haven't really noticed anything.
Okay. What about any hospitalizations besides maybe the surgery?
No, just that surgery.
Any traumatic events I need to know about besides the surgery, which is pretty traumatic?
I had like one concussion in the past.
How long ago was that?
That was maybe like 4 or 5 years ago.
4 or 5 years ago?
Mm-hmm.
All right. What happened?
Again, playing soccer. Went up for a header with somebody else, and we hit each other's heads instead of the ball.
Okay, sorry to hear about that.
Yeah.
How are you doing now? You feel a little...
I was fine. I got evaluated, and I was kind of not able to play for a couple weeks, but then after that I haven't had issues since. So.
You had no recurrent episodes or anything?
Mm-mm.
Okay, all right. Okay, so that was a big traumatic event. Have you had any hospitalizations besides the...
Mm-mm.
No
Just
hospitalizations. Okay,
yeah.
all right. I'm going to ask some questions about your reproductive history, okay?
Okay.
All right. Do you currently have any children?
I have one kid.
One kid? Okay. Daughter or son?
A son.
Oh, okay, nice. So you have one son, okay. Have you had any pregnancy complications before?
No, I
Any
haven't.
abortions or anything?
Mm-mm.
Are you on birth control?
I am, yeah.
You're on birth control? Why are you on birth control?
Just to control menstrual bleeding.
Menstrual bleeding?
Yeah, I kind of have it irregular.
All right, and you see someone about that then
Yeah,
regularly?
no
pretty much?
region.
Okay, good. All right, and have you ever had any fertility issues?
No.
Okay, no fertility issues. All right, okay. What about any, are you up to date on your immunizations?
I am.
Okay,
Yeah.
immunizations, you're up to date. So the flu shot, your maybe any other your other immunizations you're up to date on?
I'm not the flu shot,
Not the flu shot. Okay.
but I never get the flu shot.
So you never get the flu shot. Well, I would just encourage you to get the flu shot. It's important for your health, but also for the health of other people around you. And so if you're interested in that, we can talk about that more later, okay? But
Okay.
I think it's very important. Have you traveled anywhere recently?
No. Besides, like, we went on a road trip to go see some family.
Okay. All right. And was that in States or was that out of the country?
It was in the States. It was in Washington.
Washington. All right. Okay. All right. Okay. And are you do you have any youth illnesses I need to be aware about? Any childhood diseases or outbreaks?
I had measles when I was a kid, but other
Measles.
than that, yeah.
Okay. And what about any what about your yearly exams? Are you up to date on those?
Yeah.
Okay.
Absolutely. I actually just had mine. Oh man, it's like 3 months ago
3 months
now.
ago. Okay.
Yeah, but
All right.
now there's back pain. So.
Okay. All right. So you're up to date on your physicals. That's very important to keep up to date on that. Okay.
Mhm.
All right. Thank you for answering that question. Now I want to ask you some questions about your family history. Okay.
Okay.
All right. And when I ask these questions, it's about your biological mom, dad, grandparents on both sides, your son, or any other children, and then siblings. Okay. All right. Is there any chronic diseases I need to be aware about among those people?
My dad has had a heart attack.
Oh, I'm sorry to hear about that. How long ago was that?
That was maybe a year ago now.
A year ago? How's he doing now?
He's fine. He's on blood thinners.
So you would say it's controlled by blood thinners?
Yeah. Now, yeah.
All
And
right.
diet.
Diet? Okay, good. What, anybody else in the family? Any other chronic?
No, everyone else is pretty healthy.
What about any alcoholism in the family?
My little brother, but he's recovering now.
Okay. Can you tell me what happened with your little brother?
Just in high school started drinking and then just kind of followed him into college and then into after college, and he just had some trouble keeping a job and
Okay.
stuff like that. And
Okay, I'm sorry to hear about that.
yeah,
But
it's
he,
okay.
would you say he's doing better now?
Oh yeah, absolutely. He has a solid job and he's gotten married and everything. So this was a while back. He's doing better though.
Good. I'm happy to hear about that. What about any other alcoholism I need to know about?
No,
Any
not at all.
drug use?
No, thankfully.
No drug use. Okay, good. Any genetic conditions maybe in the family among those people?
Not in my immediate family.
Okay, not in your immediate family. All right. And then what about any mental health issues? Has anyone ever been hospitalized for a psychiatric issue or
Oh
anything?
no.
No. So no mental health issues?
Mm-mm.
No? Okay, so no mental health. Okay. All right. All right. Well, thank you for answering that question for me. I'm going to ask some questions about you now. So
Okay.
these questions get kind of personal, but I want to remind you that everything that we discuss is going to be confidential, okay?
Okay.
So it's okay if I ask you some questions?
Mm-hmm.
Okay. Are you currently sexually active?
Yes.
Yes. Okay. All right. How many partners?
Just my husband.
Husband. Okay. All right. And are you using protection or?
No, because I'm on birth control and
Okay.
we're married.
All right. Okay. All right. Did you have any questions for me about that?
Mm-mm.
Okay. Do you currently smoke or use any tobacco related products?
No.
No. What about in the past?
Yes, briefly.
How long ago was that?
This was back in college, so maybe like 12 years ago.
12 years ago.
Mm-hmm.
What did you smoke cigarettes or?
Cigarettes, and it was really just on the weekends. So maybe I smoked total 4 cigarettes every weekend for like a year.
Okay, 4 cigarettes. For a year, you said?
Yeah.
Okay. All right. Okay. What about do you currently drink?
Yes.
Okay. How much do you drink?
Maybe like one glass of wine per week.
One glass of wine per week. Okay.
Yeah.
All right. And what about any illicit drug use? Do you use any illicit drugs currently?
Mm-mm.
What about in the past?
I experimented with uh, cocaine in the past, but I mean, again, that was really brief, and that was the same time when I was smoking. I was
Okay.
just involved with a different crowd.
Okay, so was that about, you said that was about 12 years ago then?
Yeah.
So how often did you use cocaine?
Maybe once or twice every couple weeks.
Every couple weeks? Okay.
Yeah.
What about, do you know how much you would use? Like
I don't know, maybe like a dime size.
a dime size? Okay. All right.
I'm not sure.
What do you currently do for a living?
I'm a teacher.
Oh, nice. What do you teach?
I teach math.
Oh, good, good, good. That's the subject I'm not good at. So, what is there like a grade you teach or?
I teach abstract math at the university.
Nice, very nice. Okay, it's a pretty stressful job then, huh?
It's kind of fun actually, because
Fun.
I get all of my students are math majors who get to abstract math classes,
Good.
so they're all interested in the field anyway.
Good. Nice to hear about that. What about your diet? What do you usually eat in a day?
I usually eat maybe like oatmeal for breakfast, a salad with some sort of protein. In the afternoon, maybe with some fruit, maybe, and then maybe like a snack, like a protein bar or something. And then at night, either like chicken or fish and a veggie and maybe some sort of carb.
Okay, good. How much water would you usually drink in a day? How many cups of water?
I'm pretty bad about that. I probably drink maybe 3 glasses of water a day.
Okay. And we need to find a way to make sure you drink more cups of water. It's very important for your health. Okay. But we'll talk about that a little later. Okay. Don't worry about that right now. What about your exercise? Do you exercise frequently or?
I do. The university has a rec center, so it's kind of nice. I can just go over there in the afternoon. I probably exercise maybe 30 minutes.
30 minutes a day or like?
30 minutes a day, I'd
30
say.
minutes? Good.
Yeah.
That's good. So
With the exception of like maybe Sunday or something.
Good. So you're pretty active then. You stay healthy.
Yeah, moderately.
Good. Really good to hear. What about support group? Do you feel like there's like people or a system in your life that you can kind of rely on, depend on?
Absolutely. My husband's great, and then I mean all the other professors that I work with are pretty great. We have a good bond.
It's very important to have a support group. You know, keeps you healthy on all levels of your life. Okay, so mentally, physically, I care about that, and so it's very important to have a good support group. Okay.
Appreciate it.
All right, I want to ask you now some general questions about some symptoms. Okay. All you have to do is say yes or no.
Okay.
And these symptoms are from the past 4 to 6 weeks. Okay.
Okay.
All right. Do you have any fevers?
No.
Chills?
No.
Okay. What about any changes in vision?
No.
Any earaches?
Mm-mm.
Any chest pain?
No.
Any palpitations?
Definitely not.
Difficulty breathing?
No.
Any coughing?
Mm-mm.
Any nausea?
No.
Vomiting?
No.
Diarrhea?
No.
Do you feel like you use the restroom very frequently throughout the day, or you urinate frequently throughout the day?
No.
No. Okay. Would you say that the flow of your urine, how would you describe it? Is it continuous? Is it staggered?
I'd say continuous.
Continuous?
Nothing
Good.
out of the normal.
Okay, all right. Have you noticed any abnormal bleeding in your vaginal area?
No.
Any discharge in
No.
that area? Okay. Any hair loss?
No.
Any weight loss or weight gain?
No, not that I've noticed.
Okay. Does any part of your body easily bruise?
Not really. No.
Do you have you experienced any numbness or anything in any parts of your body?
Not really. No.
Okay. What about any muscle stiffness?
Some stiffness, mainly in my like lower back area, like along with the achiness.
Okay. And did that start about the same time as your lower back pain?
Mm-hmm.
Okay.
Yeah.
Okay. And the stiffness kind of inhibits from the movement, doesn't it?
Yeah, that and really the radiating pain is kind of what inhibits it.
Do you feel like you have a decreased range of motion in any parts of your body?
Yeah, but it's mainly like limited by the pain, I think, more than anything. I don't even want to try. You know what I mean?
So you do feel like a decreased. Okay. Definitely, I understand. I understand. What about any headaches?
No headaches.
Do you feel like you have just a general feeling of weakness in general? Do you ever feel like that? Like you just feel like really like fatigued or just kind of out of it a lot?
No,
No.
no, not really.
Okay, all right. I'm going to ask you some questions about your mental health right now, okay?
Okay.
Have you noticed any mood swings?
No, just besides like being more irritable because of the back
Back pain,
pain.
yeah.
Yeah, but
But nothing like constant or like chronic with the
no,
mood swings?
just since the back pain.
Okay. Have you ever had any suicidal or homicidal thoughts?
No, God, no.
No? Okay, all right. Okay. I'm just going to summarize some of the main information that you told me today. You told me that you had three years ago, you had a back surgery. It was a hairline fracture surgery. You had a concussion 4 to 5 years ago from playing soccer. Um, your dad actually died of a heart attack. Was there any early deaths in your family?
Um, so actually, my dad didn't die
Oh,
from it,
sorry, I
from the
missed.
heart attack. No, you're fine. Thankfully, he just had a heart attack and now he's maintained on blood thinners.
Was there ever any early deaths in your family?
Oh no,
No
no,
early deaths. Okay. Sorry about that. I didn't mean to
no,
mistake
you're
about
fine.
your
You're
dad.
fine.
And you told me as well that you work as a teacher. You don't drink enough water in the day, so I did note that down. You told me you're experiencing a lot of the muscle stiffness because of
Mhm.
your back pain, and you do feel a decreased range of motion.
Yeah,
Do you feel like I hit everything with that?
yeah, just like that radiating pain, but you talked about that earlier.
Okay,
Yeah.
so the radiant pain. I will definitely note that down. Okay. What I'm gonna do is I'm gonna take this information and go to Dr. A and we'll discuss it. Did you have any last minute questions for me? Anything you want to talk about?
Um, no, I don't think so.
All right. Thank you, Miss Katie. I'll be right back. Okay.
Appreciate it.